Hi everyone, it's Mr. Senti, and today I'd like to talk to you about the muscles that are involved with the axial skeleton. And you guessed it, they're called axial muscles. That's right. The axial muscles are part of the entire muscular system that is composed of both axial and appendicular muscles. And again, as I said, they're sort of based upon the either they're attached to the axial skeleton or appendicular skeleton. And so, one of the things that I wanted to say about this, in addition to the axial muscles, maybe obviously, maybe not, being involved in moving the head and being associated with the spinal column, rib cage. Again, all things having to do with the axial skeletal system. They aid in breathing, etc. And this video is going to be about that. But I wanted to start off with something kind of interesting. In other words, the muscles of our face, in addition to being involved in chewing, which is important, that's going to come up, it's also they're involved in non-verbal communication. And again, I think most of you are familiar with these sort of emojis right here, but these emojis that we're so fond of sort of mimic some of the facial expressions um, that we're capable of in non-verbal communication. I don't want to put myself under the pressure and make some of these faces, but see, it's a happy face right there, smiling and laughter, but they're important, and so again, they convey emotion, and they're important in terms of sadness, happy, and so all of these facial muscles can contribute to that, raising the eyebrow, being surprised, that sort of thing. Uh, in addition to that, the axial muscles are involved in chewing and in swallowing, involving muscles of the larynx. They help to support and protect the abdominal region of the body and the pelvic organs. And so all of that makes up 60% of all muscles of the skeletal system. So how's that for important? So starting from the top going down, let's talk about the scalp, or the galea, and again, meaning Latin, meaning helmet. Okay, so we have muscles right above our eyes, right up here, called the occipital frontalis. Okay, and so occipital frontalis, this is sort of interesting because the frontal bone up here and occipital bone is towards the back. And so we have these two muscles, or what they're referred to as the bellies of this muscle. So we have the frontal belly and the occipital belly, and these are connected and separated, if you will, by something called the epicranial aponeurosis. It's a tendon-like fibrous connective tissue that extends on the top of our head, or scalp, if you will. So the epicranium is composed of this aponeurosis. Okay, and then you can see here in this picture, you can see the occipital belly of the occipital frontalis muscle right there, and then here's the aponeurosis up here on the top there. And so this is the cranial. This is a good angle here. The cranial aponeurosis, again, tendons that connect the frontalis belly and the occipital area of the muscle down here. Okay. I wanted to move down to the platysma muscle right here, flat muscle that is the word I'm looking for is superficial muscle right below the skin, right here, that covers the anterior surface of the neck. And you can see it over here as well. It's rather pronounced and large and flat, platysma. Okay. Now, moving along to the face right here, one of the more important circular muscles right here, or orbicular, orbiculus oculi, is the circular muscles that surround our eyes right here, and they help to the action of that muscle is closing the eye and blinking again, making various emotions. Then over here around the mouth, circular muscles that surround the mouth, and orbicularis oris, they help to constrict the mouth from opening, and they can also sort of cause the lips to protrude in sort of a kissing motion like that. So the kissing muscles, it's sometimes referred. All right, and then the buccinator. Buccinator located right here in this diagram. Buccinator, meaning trumpeter, or technically someone who's blowing the buccina, buccina, Italian, meaning like this horn right here, buccina. So someone buccinator. So it also helps us to smile. Let's see right there, I'm contracting my buccinator, and it forces air out of the mouth. So if you're playing trumpet or trombone, moves food around more often in the mouth so that we can macerate our food or chew our food. We have these extrinsic muscles, the muscles that surround an organ, like surrounding the eye, extrinsic muscles. Superior oblique, superior rectus, medial rectus, inferior rectus down below. I wanted to point out right here, this is a kind of a cool feature right here. I found this to be curious. The superior oblique muscle right here, do you see how it's sort of going around this little attachment called the trochlea? The trochlea is a term that is sort of a structure resembling or acting like a pulley. So it's like this tendon is hooking around this piece of cartilage right here, which is helping to maneuver the eye. It's kind of interesting. And this may be obvious, maybe not. The medial rectus is moving in this case, this is looking front view or anterior view of the right eye. So this is causing your eye to be able to move medially. In other words, look inward. And this is your lateral rectus, in other words, looking to the outside. Raising the eye, lowering the eye, all very important muscles, extrinsic muscles of the eye. But what's more important than the muscles of the jaw to being able to chew, or mastication, chewing, the process of which food can be crushed and ground to teeth, mechanically beginning the process of digestion? Well, two muscles in particular are significant here. The macerator, okay, right there, the macerator muscle, and the temporalis is also important in chewing. Let's take a look at both of those. So this macerator muscle is really strong. It's the strongest jaw muscle, and it originates right here at the zygomatic arch, and it inserts at the angle and ramus of the mandible, which causes the mandible to elevate, which then closes the jaw in the chewing process. It's sometimes referred, the macerator, as the chewing muscle. And I was poking around, as I may do, somewhat nerdily on the internet. I noticed that the pound force, the chewing muscle, I was like, well, how strong is this macerator? It could be upwards to 200 pounds of force. And I thought, well, that's pretty powerful. And then I thought, well, what about other animals? Like, what's one of the most powerful jaws out there? And so I found this to be kind of interesting. Crocodile. Close to 5,000 pounds of force pressure in its macerator. That's pretty strong. So this temporalis right here is also very important because it helps to lift the mandible in the chewing process. And so it originates, its origin is in this sort of the squamous or flat area of the temporal bone, and it inserts down here in the jawbone and the mandible at the coronoid process, which is highlighted here in green. So that's what it's originating. I'm sorry, that's where it inserts. It inserts down here, the coronoid process of the mandible. And so when it contracts, it causes the uplifting of the mandible. So those are two very important chewing muscles. But then there's the pterygoid, which is also significant too in chewing because it helps to position the mandible. So all of those things combined, the crushing and sort of the positioning of the mandible, are involved in chewing. And what's, you couldn't do much chewing without your tongue, and so the tongue is made up of a variety of different muscles, and so they're named primarily based off of their origin, where they're attached. Like, for example, this one, styloglossus, is attached right here at the styloid process, right over there, temporal bone. and where it inserts, and all of these insert on the tongue itself. Okay, so that, or the word tongue. And so you have these muscles of the neck, and again, one of the more principal muscles of the neck. There's so many, and I don't really, I could name them, but it's just, I just want to point out some of the more significant ones, I think, if that's okay. And I think one of the ones that are more significant is the sternoclavicle mastoid right there, this sort of prayer muscle that attaches to the sternum and clavicle, and also the mastoid process of the temporal bone right over here, as you can see. It helps to flex the neck, and so right here is this big long muscle. It helps to elevate the sternum and clavicle, and it rotates and laterally flexes the head. So pretty significant muscle right there. I mean, you have a variety. Look at all this. You have a variety of muscles of the vertebral column. I won't mention them, but they're significant to help to maintain posture. That's one of their functions. We have muscles in between our ribs, and so these are referred to as intercostal muscles right there, and they're even in between the costal cartilage, as you can see right there. And it may be obvious that their function is for respiratory function. In other words, they help to move the ribs in order to increase the volume of the lungs, ultimately, which would affect pressure and then affect inhalation and exhalation of air. And so more detail of these intercostal muscles, we have these external, toward the outside, intercostal muscles between the ribs, and then internal intercostal muscles. And again, those are capable of, and then innermost, capable of contracting. And then, of course, they're innervated by nerves and blood vessels. Let's take a look at some oblique muscles. Oblique meaning diagonal in terms of fascicle orientation. So we have sort of layered effects here. We have these external oblique muscles right here. So external toward the outside, and then we have internal oblique, and then we have transitional oblique as well. And so functions of external oblique, they're on both sides, but one of the obliques contrasting can create a lateral flexion, and so that's important. And so here's your internal obliques right here, and again, function is to create lateral flexion of the vertebral column. Okay, better picture of these of the transverse muscles, and so this is kind of cool. How the design of this. You have your external right here, oblique, and then you have your internal, kind of going in a cross direction, and then going side to side is your transverse, and then again coming straight down right here is your rectus abdominis muscles, and the transverse abdominis is involved in compression of the abdomen, perhaps obviously. And again, this is a nice diagram looking sort of at a deep dissection of these abdominal muscles right here. As you can see, they're layered. Okay. The rectus abdominis, again, that pronounced muscle coming down the front of our abdomen, is sort of between the xiphoid process, which is the most inferior part of the sternum, and it goes all the way down to the superior portion of the pelvic, in other words, the pubic symphysis. And so it's really a long muscle right there, rectus abdominis. And it's popular in many ways. Like, for example, weightlifters love to be able to notice the fact that they have, if you've heard this expression, like having a six-pack abs or something like this, because the muscles of rectus abdominis are transected by these tendinous, in other words, tendon-like inscriptions. So these fibrous tissues that are crossing the rectus abdominis, and again, right in the center, separating the two halves of this muscle, is the linea alba. In other words, white line right there. And so you could see that it's close to the surface. And then this is a cool cross section or transverse section. The body, you could see both sides of the rectus abdominis, and here's the linea alba. And then I love this over here. Do you see how they're the various layers of the external oblique, and then you have the internal oblique, which is right next to it in the middle, and then the transverse abdominis. And so all of these are going in slightly different directions. Pretty interesting. And then, again, I don't want to play favorites in terms of what muscles are more important than others, but boy, talk about an important muscle, the diaphragm. And again, this is something that I think most people may know or heard of before, and it's characterized by the fact that it separates what is the thoracic cavity, right up here, thoracic cavity, from the abdominal cavity. So it sort of performs a bordering function right there. But its real important function is that in respiration. I alluded to this at the top of the video. So when the diaphragm contracts, it moves downward, okay, in association with the fact that the intercostal muscles are contracting. So when the diaphragm contracts, do you notice here as it contracts, it would increase the volume. It would increase the volume of this pleural cavity where the lungs are housed. And so by increasing the volume, you're decreasing the pressure. So therefore, air pressure would be greater on the outside, and air travels from an area of high pressure to an area of low pressure. So how about that? When the diaphragm contracts, that initiates the process of breathing in or inhalation. Whereas when the diaphragm relaxes and moves upward, okay, that lowers the volume, increases the pressure, and then the pressure forces the air out, so exhalation. That's pretty significant. Okay, and then this is a superior view, kind of cool. Again, transverse cut of the body. And so here's anterior, posterior back here. You can see the body of a lumbar vertebrae right there. Or I'm sorry, thoracic vertebrae. This is T10. And again, you would know that because this foramen right here is in a circular orientation. But I'm digressing. You can see here is the diaphragm, a very strong muscle, which is important in breathing. Okay, and then finally we worked our way all the way down to the pelvic floor. And so these pelvic muscles, there's many, and in general though, I think it's important for us to get the fact that they support the organs of the pelvic cavity. Okay, so those are various reproductive organs, and they're also urinary tract organs, like for example the bladder. They also help to flex the sacrum and coccyx. All right, and they control movement ultimately, especially the superficial muscles of urine moving through your urethra to the outside of the body from the urinary bladder, and also helping to control bowel movements, in other words, the sphincter of the anus. All right, and so when you're addressing these muscles of the pelvic floor, if you will, they for one thing, they support the external genitalia. Okay, so this is obviously female, and so what we're looking at here is you could sort of look at this green triangle and then this blue triangle right there, and these are often referred to as the urogenital genital triangle up here, and then this is the anal triangle right here. All right, and so they form the pelvic floor, and then below that there's a deeper muscle layer between the pelvic bones that helps support the pelvic floor of the body. And again, naming them, you're welcome to get into every single muscle of the body, but I think this was an important look at what I feel, in my judgment, are some of the more important bones in terms of their function, the names of them, a little mention of insertion and origin of these muscles in the that are associated with the axial skeleton, and thus are called the axial muscles. So hope you enjoyed the video and learned a few things. Thanks for watching.